Hello there, Pattaya. It's Dr. Ian, and today I'm at the Bangkok Hospital, Pattaya, to bring to you another one of our Health-Wise series. My special guest today is Dr. Neom. Dr. Neom is a specialist neurologist. That's a doctor who deals with the brain and the nervous system. Dr. Neom, tell us something about strokes.
So about stroke, we can easily say it is the interruption of the brain function that caused by blood supply not enough.
Right. Now that blood supply, which is not enough, is this a blockage or is this a hemorrhage or is it both?
There are two kinds of stroke. First one is bleeding. We can say hemorrhagic stroke. And the other one is blockage in an artery. We can call ischemic stroke. That can be classified in two kinds of ischemic stroke. First one is thrombosis. That means the clot blood originates inside the artery at that area. Or we can look to the other one. It is embolic stroke. That means the piece of blood or fragment of blood can transfer from the other side.
Are there any warning signs of strokes?
Only 10% of stroke victims have got warning sign.
So 90% don't know that they're at risk?
No, abruptly occur. Warning signs, it's like it depends on which area of the brain is affected by stroke. Mostly can present with numbness or weakness on one side of the body, or can present with disequilibrium acutely. Right. Some cases can come with visual disturbance, like a visual field defect or sudden blindness in one eye. But
as you say, this is only 10% of the people. 90% of the people just get a stroke like that. Now, after the stroke has happened, how long does a person have before irreversible damage occurs?
Because stroke is a truly neurological emergency, so we have time frame only 3 hours.
3 hours?
Right.
So that's what we would call the golden period.
Right.
Now in that 3 hours, they have to get themselves to hospital.
Yes, call ambulance.
Yeah. And what will be done?
Call ambulance, and our stroke team will bring the patient to emergency room, and then we will perform a computer scan of the brain urgently. This is very important because we have to differentiate between bleeding or blockage. If we find bleeding, if the hematoma not so big, we can treat by conservative treatment. But if the bleeding size is enlarged, some cases have to be operated.
Yes.
And if we cannot see bleeding, that means it should be a blockage in the artery. If the patient come within 3 hours, we have a medicine. This medicine can break down the clot blood to recanalize. So
for the people who arrive within that golden period of 3 hours, what percentage recovery is there?
From the study, it have 30% favorable, but it have 3% bad outcome, like bleeding, increased bleeding risk. So we have to wait between risk and benefit.
Dr. Neom, thank you very much. And Pattaya viewers, stroke is a real problem. It's more seen in the older age group, but younger people can get it as well. If you feel that you are at risk, you should always get yourself checked. This is Dr. Ian saying, see you next time.